The following is brought to you by VerticalVet. Rethink your GPO.
Hello, VerticalVet family. I am Dr. Ernie Ward, Chief Veterinary Officer for VerticalVet, and it is my highest pleasure to welcome you to another episode of our Vet Med School. And today, we're going to be talking about a topic that is near and dear to me, and that involves pet obesity. Now, you know, this has been something I've been interested in for a long time. I've written a ton of books. I mean, if you haven't read them, definitely go get them. You can get them on Amazon or wherever. But I've written textbook chapters. I mean, you know, in fact, if you haven't seen the new pet-specific care guide from Lowell Ackerman, definitely check it out. I've got a couple of interesting chapters in there today. So pet obesity is something that's near and dear to my heart. And so anytime I have the opportunity to talk about ways to prevent it, then I'm going to do it. And again, if you aren't already signed up to help us with our annual surveys and prevalence studies and so forth, please go over to petobesityprevention.org. That's the Association for Pet Obesity Prevention that I founded, what is that now, 16 or 17 years ago. But today, I am super happy to talk to you about an innovation that I think has the potential to really change the conversation around pet obesity. And it has to do with that really awkward time nutritionally post spay and neuter. And so today I am super happy to have with us today from Virbac, Dr. Staci Scolavino. And she is the medical communications manager for nutrition at Virbac. And she's been there for almost 2 years. And prior to that, of course, she was a scientific services veterinarian at Royal Canin. So she definitely knows this space very, very well. But before starting her career in pet nutrition industry, Dr. Scolavino was a clinician at Red Bank Veterinary Hospital all the way up in New Jersey. So thank you so much, Staci, for joining us.
Thank you so much for having me. I'm really, really excited to be here.
Well, you know, when I first caught wind of this product from way across the pond there in France, I was just overjoyed because, you know, this has been a dilemma for practicing veterinarians for so long because, you know, we would go through early spay or neuter, and we're typically talking about spaying or neutering at 4 to 6 months of age. And then we had a considerable gap in physiology and time before we could actually transition them safely to an adult diet or a maintenance diet. And so I really appreciate you guys coming up with a solution to kind of fill that gap.
Yeah, absolutely. You know, sometimes I call those pets teenagers, right? So
Right.
they're not quite really young puppies and kittens, but they're still growing after they've been spayed or neutered. They still need all those nutrients for growth, but significantly less calories.
And again, Vertical Vet membership, I mean, this is a brand new product, and I'm excited about it because it's a novel innovation within this space. I mean, I've been around, I've been very active in pet obesity for, you know, over 20 years, and it's rare when things come along that, you know, really excite you and you go, okay, this is different. And it's not so much that it's radically different, it's just serving a different purpose, and it's one that we really haven't formulated for, so I'm super excited. So I guess, Staci, the first thing I want to talk about today are, you know, what are some of those general physiological changes that occur post spay and neuter? And really, why should veterinarians say, you know what, this is probably something either I need to address or maybe I haven't been thinking about enough? So what happens after we spay or neuter them?
Yeah, absolutely. So, you know, after we spay and neuter our dog and cat patients, we know we're changing their body anatomically, of course, but we're also changing it physiologically as well. And those physiologic changes lead to a drop in basal metabolic rate. So, caloric needs of both our dogs and cats drop significantly by about 30% for dogs and 24% for cats after they've been spayed or neutered. But in addition to this drop in caloric need, we also see an increase in appetite post spay and neuter procedure. And with an increased appetite, we know if that food is left out, they're going to take in more calories. So when you put these two things together, an increased appetite and a subsequent increased food intake with a decrease in basal metabolic rates, decreased caloric needs, it's of course a recipe for weight gain over time. So our spayed and neutered pets are at significantly higher risk of becoming obese throughout their lifetime. Dogs are at 2 times the risk of becoming obese after they've been spayed or neutered, and cats are at 3 times the risk of becoming obese throughout their lifetime after they've been spayed or neutered.
Yeah, and again, this is something that we can go as deep as you want or as just superficial as you want, but veterinarians out there, again, you really want to look at some of these physiological hormonal changes. In fact, it gets even more complicated because we don't even know about what is happening with ghrelin and leptin receptors, especially when we're altering these things so early. So there's a lot to this story. But again, I love what you said, Staci. The bottom line is appetite remains high. and yet metabolic rates go down, due to the lack of sex hormones and development there. So, I mean, we've got to accommodate it for it. And, a 25 to 30% weight gain, I mean, pick your numbers. I mean, obviously there's a lot of different data on that, but we've got to do something. And Staci, I think where most of us have really been frustrated over time is because here you've got still a physically developing animal, and you're going, oh, we better be careful with the feeding, and yet that could stunt growth and cause other, even bone and musculoskeletal development problems. So again, just kind of reiterate the formulation differences, because I think for me that's the most exciting part, right? It's not just there's a new diet with a new name; it's actually a different formulation.
Yeah, absolutely. So, Virbac did a survey just last year of 150 veterinarians to try to figure out what veterinarians are doing nutritionally post spay and neuter to address those lower caloric needs of patients after they've been spayed or neutered. And the vast majority of veterinarians, if they were making any nutritional recommendation at all, were recommending either to feed less of their current puppy or kitten diet or to switch to an adult diet after the surgery. It's important, though, that we remember that those puppy and kitten diets aren't just more calorically dense as compared to their adult diet counterpart. They're much more nutrient dense as well. So they have higher levels of essential fatty acids, essential amino acids, vitamins, and minerals that those puppies need for growth. And oftentimes those values are twice that as to what's in an adult diet. So if we're switching these puppies and kittens onto an adult diet after they've been spayed or neutered, we're really setting them up for malnutrition at a very young age. Similarly, if we say, like I did, I hate to admit it, when I was in practice, I would say, you know what, why don't you just feed a little bit less of that puppy food? We'll reassess when he comes back for his annual visit. But I was cutting not only calories, I was cutting nutrients as well. Nutrients that dog or cat needs for healthy growth and development. So Verbac's new veterinary HPM junior diets are able to restrict calories. So we're giving them that lower caloric content that they need for their lower caloric needs, but we're not restricting nutrients. They're still formulated for growth. So they have all the nutrients they need for healthy growth and development without the excess calories.
Yeah, and I really appreciate you bringing up essential fatty acids, because guys, we know really puppy and kittenhood is all about DHA, and that's for neuronal growth, ocular. I mean, this is a big deal for us, and obviously the biggest time to get that in are during the first 3 or 4 months for sure, but it continues throughout development. So it's really important that we continue to give it, and like you, Staci, I would do the same thing, kind of play around with, can we get them to an adult diet and then maybe supplement DHA and other nutrients, but this just makes it so easy. And again, you did mention a couple of things with potential malnutrition. I think that's, we see that most vets are kind of playing this game of guessing. But again, when you talk about malnutrition, can you be any more specific? Like, what are some of the risks?
Yeah, so I mean, you can have severe coat abnormalities. You can have growth deformities and growth anomalies. Like you said, with the DHA, it's so important for neuronal development and neurologic development. So if we're not meeting those needs, which are significantly higher in growing puppies and kittens, that we can have neurologic deficits as well. So the risks are real, especially for those growing puppies and kittens. And up until now, we didn't really have a great solution for it. So very exciting to have this new solution for a problem that we see really every day in clinical practice.
Well, and that leads us to our next point, is that, we are seeing this every day. I mean, look, it's no secret. I've claimed that this is the number one pet health threat that we face. We've looked at the numbers. I mean, we've done all of our prevalence studies, since 2006. And guys, just so you know, I mean, we're still looking at a majority of dogs and cats, more so in cats. But maybe, tell us some of your numbers, and then I might share some of mine as well.
Yeah, so I know this is a passion project for you for sure, and it's definitely something that I live and breathe. And in clinical practice, where most of our audience are clinicians, right? I would always be amazed when I saw a dog or definitely an indoor cat come in to see me that was ideal body condition. It was like spotting a unicorn, right? It didn't seem like we saw them all that frequently. And the data is backing that up. So I'll quote one of your surveys by the Association of Pet Obesity and Prevention, that 60% of cats are diagnosed as being overweight and or obese, and 56% of dogs are diagnosed as overweight and or obese. So the numbers really are staggering. So what we feel like we're seeing, the data is backing that up. And of those patients that are diagnosed as overweight or obese, only 10% ever go on to lose the weight. So it
Right.
really is a significant problem that we have here in the States.
Yeah, and again, we do these pet owner surveys every year. We've got our 2021 coming out very soon. And every year we ask people, have you tried to help your pet lose weight, if it's overweight or has obesity? And, the vast majority, 85% always say, yeah, I'm trying something. And typically they don't know what to do. So that also is why I like solutions like this new diet, because I think it's going to help. The other thing too, Stacy, that you might, be familiar with is we've also tracked it over time. And we find that typically most of these pets, especially young dogs and cats, we would be able to identify and predict with almost certainty. And my colleague, Dr. Alex Germer from the UK, has done several studies to sort of back up and validate some of what we've done here in the US, but around 9 months of age. And that's actually completely in lock sync with what you're saying. It's like, okay, they're spayed or neutered, and then people continue to feed them too much. And then 3 or 4 months later, voila, we've got a problem that is for life. And so, again, guys, if you're watching today, you know what we're talking about. We're seeing more and more cats that are, I used to think an 18-pound cat, Stacy, was, really extraordinary. And today it's like they're 24
typical.
pounds, right?
Yeah.
And it's just breaking my
Yeah.
heart
Yeah.
because type 2 diabetes. And so, again, the reason back in the day in 2005, the reason that we named the organization the Association for Pet Obesity Prevention was because we knew that the solution, the cure, was really hard. So again, you guys are offering, some help there. So I really appreciate that.
Absolutely. And I think even the nutrition world is kind of changing their mindset. So, AHA just came out with their new 2021 nutrition and weight management guidelines just last year. And within those guidelines, they state clear as day, it's easier to prevent weight gain than it is to treat obesity. And for all of us in clinical practice, we know how hard those weight loss plans are and how difficult it is to get our patients to lose weight. So AHA really wants us to kind of change our mindset. We shouldn't just focus on getting the weight off once it's there. How can we focus on preventing the weight from getting on in the first place? So they really want us to take a more proactive approach to weight management.
Yeah, and as one of the original authors of the original 2014 guidelines, we tried to make that case clear, but it's always worth revisiting. I used to say this is the spinach you need in your diet every day. And so if we have to keep reminding the veterinary profession that obesity is a big problem, prevention is much easier than weight loss, then I'm going to continue to do it. Well, I do want to kind of talk about this. It can be a difficult conversation for some, both veterinary professionals as well as pet parents. And, I've written a lot about this. In fact, one of the veterinary clinics of North America, myself and my dear colleague, Dr. Julie Churchill from Minnesota, we wrote 1 or 2 chapters just on communication tactics. But, from your perspective, how should we be setting up this diet for success with our pet patients?
Yeah, so you're absolutely right. Sometimes having these conversations around weight management, it can get uncomfortable, right? So I would always kind of discuss with my clients. We know the risk factors associated with obesity, and we can split them up into human factors such as overfeeding, but there are also animal-specific factors, maybe that the client doesn't have complete control over it. So it's multifactorial, right? So there are predispositions to weight gain, and of course, having your pet spayed or neutered is also a risk. So kind of opening that weight management conversation with a more physiological approach rather than an emotional approach. So we can link it, that risk for weight gain to the spay and neuter procedure can take some of the emotion out of it, take some of the onus off of the client. So it's not just their fault for feeding too much. We need to address these changes that have happened physiologically after they've been spayed or neutered in order to take that proactive approach. So it helps to kind of form a team, make it less emotional. It's not all their fault.
Yeah, and again, I think I like what Stacy just said, Vertical Vet family. The fact is we want to try to take some of the emotion out of it because it is a contentious topic for many pet parents, and we don't want to judge the client. We don't want them to be felt like they are being judged by us. And again, we want to be as empathetic as possible. I think that for me, Stacy, a lot of this is just an awareness campaign because most pet owners just don't really understand that, wow, post spay and neuter, we've got several changes. Again, we've mentioned decrease in metabolic needs, 25 to 30% fewer calories needed post spay or neuter as opposed to prior to. And then, of course, we've got other hormonal changes that are going on. So I really like to center it around that. And what I like most about this is we now have a solution to insert in there. Again, as we mentioned before, It was
Right.
guesswork for a lot of us for a long time, but now we've got a better solution. The other thing too, I think that's really important about a diet like this, Stacy, to me, is it's also another way to reclaim nutrition, because
Absolutely.
I have been saying this for 20 years. It says we have abdicated nutrition and behavior.
Mhm.
Like we've just sort of said, whoops,
Mhm.
I don't know. It takes too long. I don't know what to do. I don't have a good solution for them. So we're just going to pass it off. And
Right.
again, maybe getting back to that, when would you suggest a veterinarian talk about this diet? Because I think if you wait till the day after or when they pick them up for spay or neuter and say, oh, and here's a new diet,
It's too late.
I think it's too late. So maybe give some tips around that.
Yeah, yeah. So I usually recommend having those discussions when you're talking about spay and neuter, all the benefits of why we're recommending spay and neuter, right? From decreasing the risk for life-threatening infections, decreasing the risk for certain types of cancers. So there are numerous reasons why we're talking about spaying and neutering our patients. But in that same conversation, we do need to be educating our clients on these changes that are happening physiologically and that are putting them at risk for weight gain and how we can step in to address those physiologic changes. So I would start having that conversation early by the time they're coming in for their second vaccine appointment. Prep them that after they're spayed or neutered, we're going to need to change their diet to address their unique new needs.
I really do. Again, colleagues out there, please have these conversations early. And now we've got another bridge diet. And Stacey, maybe just speak to that too, because I think that this is brand new. This is innovative. We've never had to have these conversations before. How should we articulate that it is sort of this? We go from growth diets, puppy and kitten diets, to this diet, and then to adult. How do we have that conversation with our clients?
Yeah, so first, the changes that are happening after spay and neuter are lifelong. So that increased appetite, that decrease in metabolic rate, that's something that's going to be for the entirety of the life of that pet. So these diets are designed to be fed throughout the course of the patient's life. But you can explain to your clients that after they're spayed or neutered, they're still growing. Especially if you think about those large breed dogs, maybe we're spaying or neutering them around 6, 7 months of age. They're not going to reach full skeletal maturity sometimes until around 18 months of age. So that's a long period of time that they still need a nutrient dense diet. They do not need a calorically dense diet. So that's really that window if we keep them on a puppy kitten diet where they could gain a significant amount of weight. So you need to explain to your clients we need to give them all those nutrients they need for healthy growth without the excess calories. And again, as Dr. Ward was saying, start that conversation early when they're around 8 to 10 weeks of age so they know what to expect after spay neuter.
Yeah, right. Because they don't, and we haven't been
Hmm.
telling them. So and honestly, I'll be the first to admit, for many years in my practice, it'd be like, okay, now we're going home with the spay or neuter patient, and now let's talk about changing the diet. You could tell these people are like, okay, you've just told me 20,000 things to do, and I'm not going to remember any of them. So
Yeah, absolutely. If you don't kind of prime ahead of time, they're very anxious. They see that collar, they see the sutures, and they get very nervous, right? So then is not the time to tell them, now is the perfect time to switch a diet. You need to be having that conversation beforehand. And then when they go home after their spay and neuter, they're going home with their e-collar, maybe they're going home with a non-steroidal anti-inflammatory for discomfort, and they're also going home with their new diet to
right.
address their new needs.
Right. I love it. I love it. Okay, so I know that you guys have been working on this for quite some time. I mean, Virbac is an international company, and sometimes in the US we forget just how big it is. It's an amazing
Yeah.
company. But talk about some of the tools that you're providing clinics because, I think again, the communication aspect of this is going to take a little bit of effort. I mean, we're all going to have to get up to speed and maybe even refresh ourselves on physiology and what happens post spay or neuter. But what are some of the things that veterinarians and veterinary technicians can go find out? How are you guys gonna educate us?
Yeah, yeah. So first with Virbac, you had stated we're an international company. A lot of people know Virbac in the United States. I know I did as a pharmaceutical company, an animal health company. What a lot of people don't know here in the States is that Virbac has actually been a leader in pet nutrition across the globe for the past 30 years. And veterinary HPM is not a brand new diet. So it launched in France 6 years ago, and it's since launched in 29 countries worldwide. So it is new and unique here for the States. States, but it's something that has been really a proven proposition throughout the world. As for kind of tools that we have, definitely visit the US Virbac Veterinary HPM website. There's great information there for the veterinarian as well as the entire veterinary healthcare team. Go into a lot more depth on these physiologic changes and how we can best communicate that with our clients. Definitely reach out to your Virbac representatives. They can give you tools to utilize, kind of one-pagers to give to your clients to help you communicate these changes, just to make the whole process easier for you and your clients.
Yeah, and again, Vertical Vet members, you can do a lot of this online, and there's ways to do auto ship and subscriptions for your clients that, again, keep the revenue running through the clinic. So, I mean, I really want to applaud Virbac for doing this. I know this model has been used around the world, and thanks again, Staci, for, I do think it's important to make sure that people know that Virbac is this, it's a massive company in the world, and yet in the U.S., there's a handful of products that we know, and so this is just an extension, and like I said at the very beginning, when I first caught wind of this from France, I was like, well, when are we going to get it over here? It took a little too long, but I'm really happy that it's finally here.
Yeah, we're really excited to finally be able to have tailored nutrition really to address those physiologic changes. So we're providing higher levels of protein to help support lean muscle mass, which will help with support metabolism, higher levels of both protein and fiber for satiety to help combat that increased appetite. And of course, the diets will be calorically balanced to meet those lower caloric needs. So really addressing those physiologic changes for the long-term health of our dog and cat patients.
Yeah, and I just really want to make sure that you guys get the message out and that our Vertical Vet membership knows. I mean, this is not Virbac's first pet nutrition rodeo by a long shot.
Not at all.
As Staci mentioned, I mean, they have been leaders around the world, and I know that you worked for another company, and you guys are always going head to head around the globe. I mean, when I lecture around, whether it's South America, Asia, whether it's in Europe, of course, it's always like a Virbac, big, massive booth, and they've got all these foods, and you're like, why don't we have them here in the U.S.? So I really want to congratulate you. So we'll have links, of course, for our membership to be able to contact you guys directly. Could you speak just briefly about some of like how these auto ship and subscription types programs? I mean, I know a lot of our members are already using them with other companies. How is this going to work with Virbac?
Yeah, so Virbac really understands that we as veterinarians, veterinary healthcare team, we're the nutritional expert as it pertains to our patients, not the pet store clerk or Dr. Google. We are. So in that vein, Virbac has made veterinary HPM spay and neuter diets veterinary exclusive. So your clients can either purchase them from your veterinary clinic directly or through Virbac's new e-commerce platform, ivet.com. And with ivet.com, your client will go on, they can purchase the diets and have it delivered directly to their doorstep, but they're still required to put in your veterinary clinic. So you as the veterinarian will still have an understanding of what your clients are purchasing, what they're on, and of course the veterinary clinic will receive cash rewards for every purchase that is made through the ivet.com platform. So we're really keeping it veterinary exclusive so that we have control to support that veterinary client-patient relationship as it pertains to nutrition, which, as you had said before, Dr. Ward, we'd kind of lost that footing here for a while. So Virbac really wants to bring us as a veterinarian back in.
Yeah, and I really appreciate that. And again, Vertical Vet, this is our commitment. I mean, we are looking for strategic partners to help your clinic grow. And so we think that this has a lot of opportunities for us to grow. We know that nutrition is tough. We know that pet parents are buying it online at these massive retailers. Of course, we don't even know what they're buying. So it's nice to have a company that's integrating within our own practices. They're going to help us with technology, make sure that we keep track of what they're getting, when, and so forth. And I really appreciate that because, again, one of the things that's unique about Virbac is around the world, you guys are completely vet-centric. I mean, I can say that because, I know your CEO is Dr. Sebastian Huron is a veterinarian I've known for 20 plus years, and he is completely committed to growing veterinary practices around the world. That's been part of your secret success, especially in Europe.
Right, absolutely. I think Virbac is known to be a veterinary first company. Always do what's right for the veterinarian, and ultimately that'll be what's best for the dog and cat patients as well.
Yeah. Well, listen, as we end our conversation today, any last sort of thoughts, tips, bits of advice, something that you want to make sure that the Vertical Vet membership knows as this becomes really a really hot product?
Yeah, the biggest thing I think is to feel empowered to make a definitive recommendation. So, a study came out that found 90% of pet owners want a nutritional recommendation from their veterinarian. So, our clients, they know that we're the nutritional experts. Unfortunately, that same study also found that only 15% of clients left the veterinary hospital with a nutritional recommendation. So, there's definitely room for improvement there. But feel empowered to make those definitive nutritional recommendations. AHA wants us to do it. They put that as the gold standard to tell our clients exactly what to feed and exactly how much. And your clients want that information as well. So feel empowered to be part of that wellness nutrition discussion. It really is best client care and best patient care as well.
It really is, and like Staci said, I mean, every study, both from APOP or the Association for Pet Obesity Prevention, as well as others, we've all found that clients are, no pun intended, but hungry for this information, and we just have to deliver it. And I'm telling you, it changes the lives. So again, Dr. Staci Scolavino from Virbac, thank you so much for being with us today. I mean, this is so exciting, and I know you can't wait to talk to veterinarians all around the country about this.
Absolutely. And thank you so much for having me. And, if anyone wants to reach out and discuss more and learn more, please feel free to reach out. We'd love to chat.
Yep, and we'll have contact all down below and in the descriptions, whatever. But remember, you can always just reach us right at VerticalVet, and we'll put you in touch with whomever we need to. Again, I can't thank you guys enough for spending time with us today. This is something I'm really excited about. I'm always looking for those new innovations in helping us in the war against pet obesity, and I think this is one of those. So again, VerticalVet members, definitely just reach out to us. We'll hook you up. We'll get you set up. We'll make sure that you understand and have all the information and resources you need. And if you're not a VerticalVet member yet, why not? Because this is just one little tiny facet of a larger portfolio of products and services that we offer, whether it's virtual practice management, whether it's helping you run your inventory more efficiently, or understanding how to manage employees and train your staff. I mean, we are here to help you, as we say, elevate your practice. So on behalf of the entire amazing team of VerticalVet, and I think we now have 5 RVTs, so that is pretty phenomenal as well. I am Dr. Ernie Ward, Chief Veterinary Officer. We will see you again. Thanks a lot. Bye.